I guess, presentation number 3. So you guys are fortunate you didn't suffer through presentations number 1 and 2. There's more information and it's a little tighter. So can you see my screen okay? Okay, all right. I'm going to put it in slide mode. There we go. All right. So thank you. I appreciate your being here. I look forward to this, and I recognize some names and faces, people I've worked with and have known for a long time. And you don't start out uh, wanting to be a subject matter expert in health insurance, especially, or healthcare. My path started as a job seeker, and after about 20 plus years in corporate America, rising through the ranks and being spit out during 2001. So I guess I'm dating myself a little bit, but I think some of the people in the audience remember those dark times and the times when we were evading Iraq 1 and 2. And I decided to do a 180 as a result of becoming a single parent. And that's when I started getting involved in insurance, got a license, and started answering questions and learning. And, I can't think of too many. IT, it changes a heck of a lot constantly, but healthcare and insurance does too. And so every year it's new challenges. There are plenty of changes this year, both on Medicare and on the side for people that are under 65, and I'm going to address those so that, my approach, I provide no cost professional advice and support so people don't have to rely on opinions from friends and neighbors, or worse yet, and I suffer from being very hands-on, but I've used it to my advantage. But this is one area where, kind of like doing your own taxes, you can do it, but you may be better off letting somebody that really specializes in that, because you may make some mistakes. There's actually 13 concepts I'm going to talk about. This is one slide I brought up at the South Lake group, and it's a quote from Bear Bryant. It's not the will to win that matters. Everyone has that. It's the will to prepare to win that matters. And every year I start preparing in July, believe it or not, and recertify for just about every health insurance plan for Medicare and for people under 65 in Texas. And I'm also licensed and certified in just about the same in 16 other states. So I take this very seriously, and it is my passion, because it gives me purpose in life. And I'm joyful at my advanced age that I can still make a contribution and carve out a living. Now, all of us know about return on investment, but especially for people in transition or between contracting positions, the other one I want to talk about is a return on time invested. Yeah, you could learn to do your own taxes or use TurboTax, but that may not be the best use of your time. And if you're in job transition, the best use of your time is not trying to learn and enroll yourself. And it doesn't cost anything whether you work with me or another broker near you that can represent all plans in your area and will support you through the year and help you select the best option. And that, the best thing you can do is find that next job that provides benefits, because employers are required to pay for at least 50% of the premiums. And in fields like IT and project management, larger companies are paying more than 50%. Not too many pay 50% of the employee-only premium, but 70 and 80% is not unusual. So I've developed this value proposition for job seekers, in that I can help people get hired faster. That reduces the cash outflow, and I support and advise people for life. Like Jeff, I've known you for, a dozen years maybe? And I'll answer questions, or I'll bring up questions that you didn't know to ask. And the old saying, "You don't know what you don't know," and there's no additional cost to work with a broker. I am. I Here's a few differences between employer plans and the types of plans that are available for people that are under 65, and this changes every year. There are no PPO plans in Texas and almost every other state except for states like actually Oklahoma is one of them. I've actually helped a couple of clients who had major health conditions but couldn't find anybody to do some very critical surgery. I helped them move to Oklahoma where they could get a PPO plan and at least get out of network coverage. A side story, I'll try to cut some of those out. So that's important because there's no out of network coverage for any excuse me, any individual plan for people under 65. The only coverage is for emergency hospitalization. If you get wheeled in on a stretcher unconscious to a hospital, it'll be covered, but you won't get the benefit of a network discount. You also have higher deductibles and out-of-pocket maximums and copays, et cetera, versus employer PPO plans, unless you qualify for a premium tax credit. And that's convoluted. I'm going to talk a little bit about how that works. And if you have questions about this stuff, stop me. Mike's monitoring the chat function. I don't see the questions, so Mike, if you get questions along the way, just fire away. How much you pay? This is year to year changes and regulations and plans. They change every year for people under 65. Come on, slide. Okay, now you think about insurance, you think about covering risk, and there's all kinds of risk, but health insurance is a little different. It's quite a bit different than just regular insurance that goes back to the guild days of Europe, where risk and trading days of the Dutch merchant ships, where law of large numbers spreads the risk among a lot of people. But in fact, in U.S., we're so convoluted. I've had clients, employer clients, over the year from Mexico, South America, Canada, Europe, and they just don't get our crazy health insurance system because it's so different. But basically, everybody is trying to make somebody else pay. Insurance companies want to deny claims. They want to have very strict windows as to who pays. Employers facing higher costs want to make employees pay more and want to, skinny the plans. Individual plans, Medicare plans, if you're eligible for Medicaid or children under the age of 19, maybe CHIP plans, federal employee health benefits, state employee plans, FEHB plans. I read last night that and they're golden platinum type of plans compared to what the private sector has, but they're facing they had a 7.7% increase last year and 13.5% next year. And, it's still like crazy, ridiculously platinum type of plans, but that's going to shock a lot of federal employees realizing how the rest of the country works. And also you have plans for our veterans and VA and TRICARE plans. So it's all different, and it changes. And I want to talk about inflation and healthcare in particular. Inflation in the healthcare sector is higher than any sector in the U.S. economy. And I implore you to budget accordingly and to maybe change some of your spending choices, because all of us are going to pay a greater percentage of our income and savings for healthcare in the future than we do now, and employers are going to pay less of it. You look at inflation, and I went back to the year 2000, and thanks to Google Gemini and verified by ChatGPT, we've had a 2.5% compounded inflation since the year Y2K. Cumulatively, that adds up though to 75%. So, what used to cost, I can remember buying gasoline in Akron, Ohio for, I don't know, 29 cents a gallon. It's now over 12 times that. And the gas isn't as good. But in the healthcare insurance, or in the healthcare sector, it's 3.5% health inflation, compounded inflation, and cumulatively that's 121% for healthcare, and it's not going to slow down. If anything, because of a number of demographic changes, this number is going to increase. Now, I brought this up in South Lake. What do you call this? Shrinkflation. All right, you're paying more, but also your coverage is liable to be less. And I'm just talking about facts and demographics because it'll kind of paint the picture for where we're at for 2025. Another term for this is healthcare dilution. So again, more people seeking healthcare or utilizing healthcare with fixed resources. It means coverage will be less. And there isn't a darn thing we can do about it because of these demographics. We've got 11,500 people a day, and this is the tail end of the baby boomer that are aging into Medicare over the next decade. And now you have baby boomers that are in their 70s and 80s requiring more care. And I've got clients in their 90s. At the same time, you have doctors and nurses retiring. There's a huge deficit in both. Even though we've known about these demographic changes, and we're turning away something like 600,000 applicants for nursing schools because there's no room for them, and we can't import enough from other countries to make up, even begin to break that deficit. So IT and healthcare to basically dilute what's available across more people that need it, and utilizing IT semi-solutions like telemedicine, teledoc type things. That's only going to become the norm versus the exception. And we're spending 66% of our healthcare costs for preventative lifestyle related diseases. And if I ever run for president, which is highly unlikely I would get more than one vote, I would maybe RFK would go along with this. I would do some things that would impact what people pay in taxes based on lifestyle related decisions people make. Now, how long is this sustainable? We spend 4 times as much on healthcare and Social Security that we do on defense spending. And again, you look at what we spend on the military, and then you think about what's going on in the Middle East and in Asia, Taiwan, and Russia, and you think about all those conflicts in Ukraine and around the world, and yet we're not keeping up with our military competitors. Something's got to give, and the thing that's going to give is healthcare. And let's not forget, especially today, voting day, that the government spends our money. If the state wishes to spend more, it can only do that by borrowing savings or taxing us more, or reducing the spending power of the dollar. It's our money. And why is this important? Don't go around saying, and as a job seeker, you learn this pretty fast. Don't go around saying the world owes you a living. The world doesn't owe you a living. It was here first. And also, plan B. Don't count on what has worked in the past decade to be the same to manage your health care and financial risk and access yourself to health care until you are unable to work. And I have so many clients and know so many people that have accepted positions, 30 hours a week positions at Home Depot and Lowe's and Starbucks and Walmart, who are my age. Why? it may be for the money, and I just explained why. The money doesn't cover as much. Groceries are a lot more expensive than they were even a few years ago. But the other thing is for healthcare. And one of my clients actually gave me this. I'm now a proud owner. I don't have buttons on it, but I'm now a proud owner of a Homer apron, and I'm going to use this for barbecue this weekend. So it's, that client is now able to make, to cover some of that inflation, and also to get health care as a result of being a 30-plus hour week at Home Depot. And there's nothing wrong with that. Work is good. Work, you can be proud. But let's now talk about managing risk. I talked about the lifestyle improvement and what you can do about it. The other thing is, I know so many people, and I was guilty of this until a few years ago, that I was always too busy to get my diagnostic checks and the wellness checks, and that's pretty typical of guys. If you want to have a healthier, better life with less pain and better mental acuity and a more fulfilling life, catch up on those diagnostic exams that are available in any plan that is offered through healthcare.gov and in any Medicare plan, whether Medicare Advantage plan or Medicare Supplement plan. The other thing, and I believe in eating my own dog food here, and that is to look at options and solutions outside of the U.S. I spent 6.5 weeks the year before last during the summer traveling throughout Mexico in places. I have expat clients in a number of countries, and I wanted to get boots on the ground information throughout Mexico as the best places for healthcare for people that are traveling or becoming expats throughout Mexico, and was able to find some places that are very popular among U.S. and Canadian citizens and Europeans to relocate to that were horrible for healthcare. And they may be fine when you're in your 50s, but they're sure not fine when you're in your 70s. And there are a number of vets that also retire because they're able to in parts of Mexico. There's also some areas where you can find awesome healthcare. In Mexico City, I was able to walk in and meet with a cardiologist who was a fellow. And there's about 1,000 fellows across the world. And this man spent an hour with me, no appointment, did some tests, said, "Hey, if I ever need surgery, they could do it." So and I felt very comfortable that he was the tops. And also dental care. I'll talk about that later. So that's other options I want to throw out there, but also learn to manage your own health risk, whether you're in transition or not. And don't forget about this when you're in your next position. So whether you're employed or unemployed, you're going to pay more. I've beaten that to death. So please reassess your priorities and budget accordingly. And the more you're employed, the less you will spend because the employer is going to subsidize that premium. And the more money you're going to have because you're getting a 1099 or W-2, you'll have more money left over. And so remember, return on time invested, job search, and landing your job is 1, 2, and 3. And if you're doing your own taxes or trying to figure out your own options through healthcare.gov or at medicare.gov or other places, I submit that may not be the best use of your time right now while in transition. Now I'm going to shift to coverage throughout for people that are under 65. And I mentioned there's no out-of-network coverage no out-of-network coverage in Texas and in most other states. And what that also brings up that people may not think about is travel as an issue. If you travel outside of the network area, which may be certain counties around DFW, maybe DFW, maybe the state, Maybe there's no coverage out in that state, but if your position or if you're planning to travel across the country on vacation, travel is an issue. Also, HMO plans predominate in Affordable Care Act plans through healthcare.gov. Those require a referral. So knowing if your doctors and hospitals are in network is essential, as is urgent care. How many of you know the hospital and the urgent care center that is in network for your health insurance plan? I submit that as something that you want to know. Hospitals and urgent care, and there's so many bandit urgent care centers or quote unquote emergency care hospitals set up around Texas that you go to one of those thinking that it's only going to cost you 40, 50 bucks, you may be in for a big surprise. Also, plans to the Affordable Care Act. There is a function adjusted gross income that you estimate, sorry for the typo, that's estimate, Mike, for 2025. For your household for your entire household determines how much you pay in premiums and also your out-of-pocket expenses. You could use your last tax return from 2023 or this year's estimate. That doesn't matter. What matters is your 2025, what you project for your income for 2025. And I know when you're in transition that is tough, but I help people with this every day. This is a chart from the Kaiser Foundation based on federal government. It's a very, very useful chart that I'm going to spend some time on, and if you have questions, put them on the chat, because this is essential for knowing about how premium tax credits, which again are your money, okay, it's your tax money coming back to you while you're in transition, based on what you estimate as your household income for 2025. So you can look at this based on your household, and this is how many people are on your tax return for 2025. That's what counts, okay? So if you have a child that is 26, he may still act like or she may still act like a child, but they can't be on your tax returns. People under the age of 26, you can put on your tax return. You may not do that. They may be employed elsewhere, but this has to do with who files taxes that you estimate for 2025. Between 100, this is the federal poverty level, is 100% here, okay? Based on your family size. It extends to 400% of the federal poverty level for a single person, for a tax household of 2. And this is adjusted household gross income, not net. The only thing that would differ is any between your total gross and adjusted gross is your deductions for 401ks and IRAs. Okay, so let's take a look at 100% first. If you're at below 100% of the federal poverty level, what does that mean for Texans? Well, in Texas, we did not expand Medicaid. In other states that expanded Medicaid, and about 26 states have expanded Medicaid, you would be eligible for Medicaid. However, in Texas, we have not expanded Medicaid, and I don't believe it will anytime soon. But below 100% of the federal poverty level, you can apply for coverage, but there's no premium tax credit. And so if that's the case, a plan through the Affordable Care Act may very well likely be more expensive than COBRA, especially if your last job or if your COBRA eligible position, you were older than the average employee for that company. Why? Because how much you pay as an individual is based on your age as opposed to the average age of the company. And larger company, if you work for a larger company and had COBRA benefits, eligible for COBRA benefits, then their cost will be that much less. So again, some of these things are very important. So below 100%, no premium tax credit. It's a sliding scale in terms of the subsidy you receive for your insurance out to about 400% of the federal poverty level. And these are already approved by Congress through 2025. Don't worry about 2026. Let's worry about that midway through the year to see if they get renewed for 2026. A lot of this will depend on what happens today and as the election results unfold over the next week to next few months. Okay, now the other key number is 150% of the federal poverty level. And I'm just talking premiums for a second, okay? At 150% of the federal poverty level, if you have a child under the age of 19 in Texas, they are eligible for CHIP, which is Texas Medicaid for children. Pregnant mothers, individuals at low income over the age of 65, and eligible children under 150% of the federal poverty level for the household, and also certain disabilities, they're eligible for Texas Medicaid. That's not necessarily a bad thing. CHIP is an awesome and a very affordable option for children, adult children. They are managed care plans. They are affordable. They vary by state. And the other thing to note is that if you complete an application through healthcare.gov and your income that you estimate is less than 150%, then the application for the children will be sent to Texas Health and Human Services, the CHIP division, and normally it takes about 60 days to get a letter sent. But these days it's taken 90 to 120% because of the backlog in Texas of about 1 million people that were able to stay on Medicaid. And this is the same in other states. It's just in Texas we have about 1 million people that fall into this. About 1 million people that were on Medicaid, but nobody checked who was eligible for Medicaid during COVID times. That expired last year. Those lifting of restrictions, and so they're so backed up it may well take 90 to 120 days before you know if the children have been approved for CHIP. If they're not approved for CHIP, then they can be added retroactively to the date that your coverage starts. I will also share on this webinar a sneaky thing that a client told me, that if you fall into that and you've gone out to like 80, 90 days, what you want to do is call pound 211, and just go through the prompts. Speak with a representative. Speak with a representative. Speak with a representative about 5 times, and you'll get actually a live body on the phone who will answer your question. If you don't do that, or you try to call, or you show up at the CHIP office in Fort Worth or Dallas or in other areas, they're not going to be able to help you. If you just wait on hold, you'll never get through to somebody. But if you go pound 211 and continue the prompts about the 5th or 6th person during business hours, you actually get a human being. Okay, now that covers premiums, okay, and who's eligible. It's a sliding scale. The further you get to 400% of the federal poverty level, the less of a premium tax credit you get. But I have had blended family clients with actually 8 people in their household. It's one of these Brady Bunch situations, and they were eligible for a pretty hefty premium tax credit, even at 8 person with a very, between 2 people working, we're able to qualify for pretty decent premium tax credit. Okay, the other thing is that, again, at 150% or to 100%. If you select a silver plan, then not only do you get a premium tax credit, but you're also eligible for a subsidy of your out-of-pocket expenses, your deductibles, your co-pays, and your co-insurance if you select the silver plan. So you may know somebody that say, hey, I've got best insurance that I've ever had, and I'm only paying this much, and my deductible and co-insurance is this, if they know what co-insurance is. That is because they are in this 100, or you are in this 150% bracket. And I've had clients that were able to get both hips replaced, back fusion, because for that year they weren't able to work due to injuries and pain, but they were eligible for that silver cost sharing, and their premiums are very low. So that's the time when you want to load up, get everything fixed and taken care of while your income is low and while you're in this range of 100 to 150%. Now I'm going to shut up and answer any questions or that may come up. Does anybody have questions? Yeah, uh, Lake Chappas. There is Lake Chappas south of Guadalajara. There is a ton of expat VA people who I met the summer before last, and between that and a 4-hour bus ride to Mexico City, that's the best option. But obviously, flying to Phoenix might be a whole lot more expeditious. Okay, again, if you're below 100% of federal poverty level, then no premium tax credit in Texas. You pay the same amount. Again, recapping, 150% or less if your kid's under the age of 19, their application's going to CHIP. Remember, pound 211. If you are pregnant when you enroll, then your coverage will be through Texas Medicaid. Again, it's very affordable, but it has a different network. So your doctors and hospitals may be different. But I can tell you that the same, on the Dallas side, Parkland is one of the top teaching schools in the country, and they have one of the top maternity departments in the country, and the same doctors that are professors at UT Southwestern uh, handle Parkland first. It's well known across the country. Also, I help clients who may have parents from, let's say, India or Asia, Canada especially, or Europe, who are no longer able to help themselves, but didn't pay into Medicare. They would qualify. They would mostly qualify as long as they're a legal resident alien for Affordable Care Act and a premium tax credit. Now, again, I explained up front, if there's no premium tax credit, then COBRA may be a better plan at a comparable monthly premium. So, and again, it all depends on your situation, not your neighbors, not your spouses, not your friends or relatives. Everybody's different, and everybody's health is different, and everybody's risk tolerance is different. A couple more things. There are special election periods. If your household adjusted gross income estimate is less than 150% of the federal poverty level, then you can change your plan or elect coverage throughout the year. Now, if you change your plan, your deductible and co-insurance and out-of-pocket expenses, it all starts back to zero. But if you're applying for the first time through the year and you weren't able or didn't enroll during open enrollment, you would qualify for this special election period at any point through the year. Loss of employer coverage in the last 60 days. And then if you move out of a planned service area, for instance, some of the Scott and White health plans are covered in Central Texas and in Dallas and in Collin County, but if you move to Denton County, sometimes just like right across the street, that's a loss in that's a loss in coverage because you've moved out of the plan service area and you could enroll in a different plan. Now, if you're traveling, consider a low-cost accident plan. It's not ideal, but that's really about the only way to reduce the risk of a high deductible and out-of-pocket maximum. But even if you aren't traveling, but if you have a high out-of-pocket maximum, an accident plan is not very expensive, and it covers out-of-pocket medical expenses. And we talked about all the carnage we see every day on the highway. This is one way, if you're faced with a high deductible, reduce that at a minimum cost. I always get asked, or I'm always say, well, Mike, what I'm looking for a plan with a low deductible and has all my doctors and is within this price range. And I said, great, you have just described the unicorn plan. There's all kinds of snake oil salesmen, unfortunately, that will sell plans based on, hey, it's this or it's that, and it's affordable, and it listen, if it's not a plan on healthcare.gov, it's not going to cover uh, all any and all pre-existing conditions unless it's Medicare, an employer health plan, and COBRA. The other options, legitimate options, short-term health plans, will cover you for up to 3 months, but they do not cover pre-existing conditions. And there's some other limitations. You have to be within a certain height, weight, and no surgeries within the last few years, etc. Also, there are Christian healthcare sharing ministry programs. I was actually on one for 5 years, MediShare. Of the Christian healthcare sharing ministry programs, this is one I recommend because it gives you access to a nationwide network of doctors and hospitals. The others do not. And the selling point is, well, you can negotiate with your doctor. Well, I don't know about you, but if you have some money in the bank, and you try, or even if you don't, if you try to negotiate with a doctor or a hospital is not going to admit you unless you prepay and submit your insurance plan. So there may be some places that will, but MediShare it does not cover pre-existing conditions for the first 3 years. It can be affordable, especially at the higher out-of-pocket maximums. It gives you access to a network of doctors and hospitals, so you don't have to try to negotiate all this on your own. Also, vacationing or traveling outside of the U.S. I'm a certified medical travel professional. This I've mentioned my Mexico travels to learn about the healthcare systems in Mexico. I also actually broke a tooth. I'll talk about this later, and flew to Costa Rica in August to get very high quality dental care. I've got a brand new mouth at a fraction of what it costs in the U.S. But when you're traveling or vacationing outside of the U.S., whether it's out of Galveston on a cruise or somewhere else, or flying to Cancun or Cozumel or to Canada or Europe, you're not going to be covered on an ACA or maybe some employer plans, but don't be fooled by the minimal coverage plans that are offered by travel agencies. They don't make any money on offering insurance, and usually it's lost baggage insurance and a tiny little bit of medical coverage, but the cost of international medical coverage is super affordable. So I'm going to pause for a second. If anybody has questions about plans for people under 65, and see if there's any questions. Yeah. Hey, Jeff. Sure. Mm-hmm. 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 Uh-huh. That's right. Now, if you're on a gold plan, well, first of all, let me talk about renewals. Some of the no, let me answer your question directly first. The cost sharing subsidy is only available for silver plans if your income, your estimated household income, even though you're the only one applying, that would include income for your entire household that you estimate for 2025. Okay. So then if your income it falls between 100% and 150% of the federal poverty level, and it's going to be closer. There'll be more of a subsidy towards 100 than 150, obviously. But if you select a silver plan, you're and you're within that 100 to 150%, then your out-of-pocket expenses, your deductible co-pays and co-insurance will be eligible for what's called the cost-sharing subsidy. So your co-pays and deductibles and co-insurance would be bought down. If you're beyond 150% of the federal poverty level, then what you want to do is search for the lowest out-of-pocket maximum plan and not the lowest premium plan, and look at those. And there are some plans that have somewhat lower, maybe higher than you used to for an employer plan, but you can't really consider that as an option. But look at the plans that have the lowest out-of-pocket maximum. There are some gold plans. Yeah, right. Okay, so if your household income is that you estimate for next year is in this range, then you would be eligible for a cost sharing subsidy that would buy down your out of pocket maximum. Or, yeah, your deductible and co insurance. If it's up here, then you may be looking at an out of pocket maximum. There's some plans next year that'll be not necessarily Blue Cross, but there are some bronze plans or gold plans where your out of pocket maximum is 95, 9,700 bucks. Mm-hmm. Yeah, it's your tax household, and even quote unquote adult children. I've got a couple of those, although they're a little older, but they're still children in my eyes. They It's who's on your tax return, but if the child is working, gainfully employed with a plan that with a company that offers benefits, and he's on the employer's. I know it doesn't apply to you, Jeff, but if you have children that are on employer's plan and you don't plan to include them in your tax return, then you don't count them. It's just who do you put on your 1040 for 2025? Yeah, good question. This is one of the confusing parts that trips up everybody. And this changes every year. The rules and regulations change every year. And if you call healthcare.gov, they'll spend an hour and a half reading from a script, and they'll confuse themselves and yourself. All right, I'm going to move to Medicare, and some of this is a primer that those of you that have been on Medicare for a few years probably know. But if you're approaching Medicare age, and that's anybody 65 or older, or someone who has been on short-term Social Security disability income for 24 months, then they're eligible for Medicare. Uh, Next year in 2025, if you have worked a total of 10 years, 40 quarters, then you've already paid for Part A. All right, that's what that payroll deduction has been all those years. Part B, or if your spouse has, if maybe you haven't, but if your spouse has or your ex-spouse has, then you can apply for Medicare as long as it's been for 10 years. Part B, as in boy, approximately this year it's 174.70. Next year it may be about $180 per month. There's also a tax called IRMA, IRMAA. And if your income, if you have your last 2 years of income have been, as an individual next year, it's about 108,000 and about a little less than double that for a couple. And if your income is beyond that, then you start getting penalized and pay more for Part B and also Part D drug benefits, whether it's through a standalone Part D plan or Medicare Advantage plan. So IRMA, it's a rolling 2-year average. It's hard to skip, but it can make a big difference based on your income. You can appeal it if you have retired or if your income has been reduced. Gradually over a couple of years, you may be able to appeal that IRMA tax penalty if you're in that range. Now, A and B cover 80% of your medical expenses, but if that's all you have, and I know a lot of people may only have not a lot, but some people only sign up for Part A and B, and they might have signed up for a Part D drug plan. But they'll go bankrupt sooner or later. So you get old, we only have so many years above ground, and that other 20% is what bankrupts people because this is unlimited risk. You cap that risk with either a Medicare supplement and a Part D drug plan or a Medicare Advantage plan. 60% of the people that apply for beyond that now for Medicare select the Medicare Advantage plan, and they've never heard of a Medicare supplement plan and a Part D drug plan. Why? Well, first of all, the barrage of advertising you get and junk mail and spam and celebrity TV endorsements are all for Medicare Advantage plans. And Uncle Sam encourages that and incentivizes insurance companies, and they want people to sign up for Medicare Advantage plans. And I'll explain why. But a Medicare supplement plan, it's not, the premiums are high in comparison to a Medicare Advantage plan, but they're still somewhat affordable compared to an employer plan or even a plan through the Affordable Care Act. But this is the way to manage your health risk throughout your whole life with this option. And if you're approaching Medicare age, then I encourage you to check into this or call me. The reason being is that you're not going to hear about it. You can enroll in what you buy from Uncle Sam, A and B, 3 months before your 65th birthday. Or you may decide, if you've got one of these orange things and you're taking that into work every day, or you're just working past age 65, then you want to enroll in Part A only until you terminate from your health plan, your employer health plan, and at that point you sign up for Part B. You have 60 days then to enroll in Part B, and then you get a new Medicare card with A and B on it, and then you can enroll in either of these. Now, yeah, and I'll explain that, Steve. The Part A, and here's what happened, especially as employer health plans have become more sophisticated. If the insurance company that the employer uses or if it's a self-funded plan especially, if the third-party administrator audits the claims, and this happens a lot because it's a major savings to the company. If the employer audits the claims and determines that Medicare Part A would have covered some of those expenses, then, and I've had usually, it didn't happen last year, but it's happened probably about 4 or 5 times across the last 10 years. If people don't sign up for Part A, one client who had quadruple bypass and never knew I had to sign up for Part A, and he was then the insurance company that will remain nameless did audit the employer's health plan, determined the percentage that Part A would have cost, and sent the bill for those claims to the employee, and that devastated them financially. So I encourage everybody to at least sign up for Part A when they're if they decide to work beyond age 65. And I encourage people to work beyond age 65 for inflation reasons I mentioned earlier. And then when you leave the plan, which will happen sooner or later, either by choice or not by choice, that's when you enroll in Part B. And then what you need to do, there's a special form that your employer signs that will vouch that you have had coverage that is at least as good as Medicare back from when you were 65. I'm getting into the weeds here. For those of you who are not 65 yet, just know that there's a lot of rules and regulations. Don't worry about it now, but as you start getting to that age, just know that there are some things that you have to be aware of. And Medicare, let me tell you, it's an awesome deal now. Medicare Supplement Plan G, which anybody beyond a 1954 baby like myself is the best coverage that's available. If you're 65 in Tarrant County, since some of you are in Tarrant, woman may pay about $110 to $130 a month in premiums. A guy may pay, because we have more health claims, may pay 20 or 30 bucks more. But a Medicare Supplement Plan G will reduce the out-of-pocket medical expense risk this year to $240. Next year it may be $250. And why is that important? Because you have one opportunity to enroll in a Medicare supplement plan without having to answer medical questions and your application be approved or disapproved during underwriting. And as we get older, or maybe before age 65, it's more likely that you're going to have medical conditions that will knock you out and not be able to qualify for Medicare supplement plan. So instead of a $240 out-of-pocket maximum this year, a Medicare supplement, a Medicare Advantage plan, you're looking at least $3,500 in out-of-pocket medical expense risk every calendar year for the rest of your days above ground, and that will also reduce what doctors you can see. In a Medicare supplement plan, you can see any doctor anywhere in the country that accepts Medicare, and any hospital. So you can go to any number of places, whether it's now or when it's 10 years or 15 years down the road. But sooner or later, whatever you will pay for Medicare supplement in premiums versus Medicare Advantage plan, you got to know that what you're paying out of pocket expenses will likely be less on a Medicare supplement plan and give you access to more doctors and hospitals. And as I mentioned, the baby boomers that are retiring, and doctors who are off, and nurses who are retiring, the less choice we will have, and the longer it'll take to get in to see your primary care physician or specialist. And right now, yeah. Yes, G is in go. Now this is stuff because Steve prompted me to answer some more questions about Medicare, but the recording will. Well, I'll render this and put it in the recording. But if you have questions, I pride myself in answering every phone call on the first ring, or if I'm on the phone to return the call. Emails may take a couple of days during open enrollment. Same LinkedIn questions about this stuff. But I make myself very accessible. But believe me, I am following up with clients, and I'm blessed to have a lot of clients. I'm following up with them till all hours of the night, and I can't keep up with emails. But I try to respond to texts, set up a time to talk, answer questions, get the information I need to send recommendations. Any other questions? I catch my breath here and get a swig of water. Yeah. hmm No, quite the opposite. I recommend when you're turning 65 a Medicare supplement plan and Part D drug plan because it lowers your out-of-pocket medical expense risk versus a Medicare Advantage plan, and it gives you far greater access to doctors and hospitals. Another little factoid: by the time people reach 67, on average, they have two comorbidities. May not kill them, but they're going to have higher medical expense risk every year for the rest of their life. And the older you get, the more you're going to be spending with a Medicare Advantage plan that will have lower premiums, but a Medicare supplement plan will reduce your out-of-pocket medical expenses. That changes when you hit usually when you hit age 75 or 80. If your premiums on a Medicare supplement plan get to about, I'd say about $300 to $325 in today's dollars. It'll be different in 5 years, but if you get to premiums in that range, then you may want to consider a Medicare Advantage plan just because of the out-of-pocket medical expense. But for right now, it's hard to beat a Medicare supplement plan for reducing risk. And these are the things that people don't think about when they're 65 or 67 or 68 and on an employer plan, because hey, I'm healthy as a horse, and you are healthy as a horse until the day that changes, and then and I can attest to that. Then you're looking at being restricted on the doctors you can see, how long it takes to get in to see a doctor, being approved to see a specialist, and what you spend in medical expenses. So you gotta look at the long term, whatever long term means. Yes. Great question, Mike. And that if you have a crystal ball and can say when you hit that day when all of a sudden you're on some expensive medications, or maybe you're no longer height and weight proportionate, or that you have had been diagnosed or treated for some type of medical condition, that day comes, you will not pass underwriting guidelines. So at that point, you will be on a Medicare Advantage plan for the rest of your life, most likely. And of course, rules can change every year, but I don't think that portion will change. Medicare supplement plans will reduce risk. If you are still relatively healthy and over the age of 65, or you are under age 65 and enrolling in Medicare for the first time, regardless of your health, call me and I can do comparisons and all that, and tell you what the options are and what the risk elements are. And this is stuff that they don't tell you when Whoopi and Joe Namath are touting this and that, or the infomercials on TV, late night TV, or alternative alternative programming to the NFL, always talking about Medicare Advantage plans. They never talk about Medicare supplement plans. And agencies, brokers, and even Medicare.gov, they want people to enroll in a Medicare Advantage plan, and that's where the money is for Uncle Sam, because they have to dilute and they have to dilute access to care among more and more people being eligible for Medicare. And it's also where call center agencies and insurance companies, they make more money than they do with a Medicare supplement plan. And again, this is all subject to annual changes. This year, there are a lot of changes. I'm going to go on to the next slide because I know I'm right at the 1 hour mark. Um, I mentioned, yeah, go ahead. Well, it's if you're on your employer's health plan and it is as good as Medicare. Okay, that's the key thing. And smaller employer plans or HSA eligible plans are not as good as Medicare. So if that's the only option your employer offers, then you may well have to sign up for Part A and Part B. And then when you terminate from the plan, then there's a special form that you send your employer, ask them to complete it. And it may take going back a couple of employers if you switch jobs that testify that you have been covered. They certify that you've been covered. They have to sign a data. It's usually the HR department, and they're used to doing this. They have to certify that you have been covered back to age 65 on a plan that is at least as good as Medicare, or you will pay a penalty that won't go away for the rest of your life. Sure. Yeah. Hmm. Hmm. Exactly. Oh yeah. Hmm. Yeah, and this is not a. I hope you understand this, please. But bottom of my heart, this is not solicitation. I will help anybody that calls. This is how I make a living, and everybody. Listen, once you're 65, what do? You talk about your heart, or you talk about this, or diabetes, or you talk about Medicare, and you get a lot of opinions based on people's uh, information on their experience, and everybody's different. Your spouse is different, or your girlfriend or husband or boyfriend made their situation is different. Risk toleration is different. The health is different. Medications are different. Everything's different for one person to the other. Now, certified Medicare advisor, there are agencies that are federally funded, including some through what the heck is the organization in Dallas that will provide advice that anybody comes in, that will look at differences between Medicare Advantage plans. They are not, you want to ask, if you're evaluating somebody, how long have you had in business? How long have you been in helping people with Medicare? That's important because this is not easy. It's a cumulative learning experience. Anybody that's relatively new, they may have gotten a job and they've gone through a training course and gotten a certification, but they don't necessarily have the understanding of the differences between one company and another. And especially this year with the changes that are going on in Medicare, that's important. And the other thing is that they are not licensed, then they should not be giving advice. And there are a lot of agencies that have um, unlicensed people giving advice, and that is a problem. Any agent is required to go through annual certification for every stinking health plan that they represent, and also they're required to offer to have errors and omissions insurance. If I omit information to a client, then I am subject to a lawsuit. That's not going to happen if you're talking to somebody that is volunteering or even getting paid by a state agency. You're not going to sue the state and win. So just be cautious of who you talk to. All right. Yes. What is your age? I'm sorry. Who's speaking? Hey, Michelle. I'm sorry. Are you over or under age 65? Okay. JPS is a great system. Now, what with the Medicare supplement plan, I'll just talk about Medicare for a second. The Medicare supplement plan, JPS is there is no network in a Medicare supplement plan. The JPS does accept Medicare, so that's an option. Within Medicare Advantage plans, though, JPS and the doctors employed or contracted with JPS may or may not be in a Medicare Advantage plans network. So that's important. But if you don't have A and B, then you're going to be subject to or drug coverage through Medicare Advantage plan or Part D drug plan. Then you are subject to penalties for the rest of your life and taking unnecessary risks. The best thing to do is to you may have key doctors. Maybe you haven't hit the age where you have to worry about medical conditions. At some point you will, but accessing doctors when you need them and being able to see specialists when you need them. It's important to think about what your health might look like, not at age 65, but at age 70 or 75, because it may be a lot different. And JPS is a wonderful system. There are plans that will include JPS, but will not provide in-network coverage outside of Fort Worth or outside of DFW or outside of Texas. So, there's a myriad of different issues when making these decisions. And that's why, you could talk to JPS, you can talk to an advisor, you could talk to your friends, relatives, neighbors, some pastors even will have somebody giving advice, but it's not advice, it's opinions. You have to talk to somebody that is licensed and certified and experienced to know some of this stuff. Uh-huh. Hmm. Yeah, disability after 24 months of Social Security disability income. There's eligibility for Medicare Advantage plan. At age 65, which your son may not be approaching, I wouldn't think, but at that point you could make a selection. You could make a selection to a different Medicare Advantage plan, but at age 65 he could shift to a Medicare supplement plan if that makes sense. Sure. All right. Okay. What's new with Medicare? Now, don't believe everything you hear in the Inflation Reduction Act. I refer to as the Turn Out the Vote Act. Why? Touting a maximum of $2,000 maximum that any quote unquote senior will pay for medications. Not really. Uh, what is true, and this is in the fine print, is that if your Medicare Advantage plan or your Part D drug plan, yeah, the medications that are in formulary, in the plan's formulary, key, are if the medications are in the formulary, the most you will spend is $2,000. There's also no more donut hole in 2025. However, in reality, and this was not an inexpensive act to pass. The Inflation Reduction Act, as far as medications go for people on Medicare what they don't tell you is that prior to this year, insurance plans were responsible for 10% of the cost of medications. 2025, they're responsible for 30% of the cost of medication. So who do you think pays the difference? Us, the people that pay taxes. What happened is that, well, as a result of that, plans have changed the formularies so that medications that were covered in 2020 or are covered this year in the formulary are out of formulary next year. And I'm running it. Let me tell you, I'm amazed at this, but they don't talk about this. So it's important that you look at, or you have somebody who is licensed and certified review your drugs to make sure that they will be in the formulary next year. Because if you're on some medications, then that can lead to big costs, and then you may have to talk to your doctor about alternatives. But you also have to be sure that that you're in the best plan for your particular needs. Yeah, Steve, go ahead, Steve. Uh huh. Yeah. No. Oh, thank you. Yeah, I'm living in the past, I guess, but things have changed. Thanks, Steve. All right, thanks. So, anyways, Part D drug plans also, standalone Part D drug plans, the premiums are going up. Also, the federal government, and this is insurance companies have known this. They are requiring insurance companies to be more efficient. They all get incentivized based on a whole number of things and how much they get reimbursed by Uncle Sam for each Medicare Advantage plan and Part D drug plan. So you're seeing reduction or retraction of Medicare Advantage plans, and also the benefits in plans compared to 2025, which results in higher medical expense risk. Um, this is just a recap. A lot of changes here. I know I'm going over, but we had questions about Medicare, and I could tell that this was a key factor. I'm going to talk for just a second about dental and vision and life insurance. Please, if you're under 65 or over 65, don't waste your money on individual dental or vision insurance plan. You have higher premiums. You will have a 1 year waiting period for any major work, which means you're basically paying a lot of money for routine cleanings and x-rays. And many of the better dentists throughout the country, especially in DFW, they have successful practices and they don't need to reduce their premiums because they have plenty of loyal clients, loyal patients. So in-network dentists, even but many of the better dentists, out-of-network dentists, um, you're paying premiums and not getting any benefit. There is what's called usual and customary rates for uh, reimbursement on PPO plans, dental PPO plans, but that usual and customary rate plus what you pay in premium is not worth it. I related earlier about having a great dental experience in Costa Rica through a colleague I knew has an awesome practice. Every single dental specialist, they do everything from inlays and gold braces, believe it or not, for rappers to guys like me that break a tooth and need to get a crown and insert. Go to somebody in Frisco who charges $4,100 but doesn't do anything else, and I fly to Costa Rica for a couple $100 and a couple more $100 for staying for 3 days, and I flew back after 2.5 days with uh, finding that I get down there, I don't need a extraction and an insert. They were able to put a crown on it, replace 3 other crowns, do a deep cleaning and laser bleach for the same $4,100. So I came back 3 days later, happier than a clam. I could have done that in 6 months trying to do that in the U.S. I was able to do it in 3 days for the same money, but getting the equivalent about $15,000 worth of dental benefit. I highly recommend these folks, Prisma Dental. I've had my teeth cleaned in Mexico and some minor cavities in Mexico. I can talk about that. But if you need something major work, think outside of the box if you have a passport or willing to get one and travel. And Costa Rica is very safe in San Jose. Life insurance. If you're between jobs, wait until you're reemployed because you will not qualify for very much life insurance. And don't rely, please don't rely just on the type of group life insurance that's available for an employer. You can also get life insurance now that has a death benefit that can be converted to long-term care. But now's not the time to talk about that, but after transition, when you have an income, talk to me about it. I can talk to you about that. Medications. Yeah, absolutely. Walmart, you can go to get the checkup. Target, any of the optical places, it may charge you 30 to $50 for the uh, the exam, and you walk out with a script. I go to, and I I just recently had cataract surgery thanks to Medicare, so I don't need what I used to need, but I would get glasses at any number of online retailers, including Zenni Optical, Goggles for You, a couple of other places that will provide awesome. You can pay for designer glasses or knockoffs with your prescription. So yeah, go ahead. Uh huh. Where is she? Where is she? Okay. Uh, mhm. Sure. Well, Medicare Advantage plan will have some minimal dental benefits. Okay, and usually those are HMO plans, and at 91 Medicare supplement plan. If she didn't have one, or even if she has one, the premiums are probably affordable. That's there. She'd have to go in network. Really, the only other option would be there are dental schools. She might be able to get, like in Dallas, a dart bus, or the equivalent in Fort Worth. and to the dental school in Dallas. That is the Caruth Dental School. It's an A&M school that's right next to Baylor. I believe there's also a dental school in Denton. Can't think of the name of the one in Fort Worth, but they will provide, and these are second and third year dental uh, students who under the supervision of professors, and that's probably the next most affordable option. But again, she'd have to travel. Medicare Advantage plans often have a dental benefit, but again, you have to consider the medical expense risk to convert. But most Medicare Advantage plans will have a little bit of dental, a little bit of vision. Those are being cut back this year. But the trade-off, and those are the benefits that they will talk about: dental, vision, and hearing. That's with Joe Namath and Whoopi and all the junk mail you get. But what they don't tell you about, and they kind of hide, is the difference in medical expense risk that you're taking on and the access to doctors and hospitals. At 91, she probably has a Medicare Advantage plan. So then it's a matter of sorting out all the benefits. Who are doctors? What are the drugs she takes? Um, and then after considering the risk factors, the likelihood of medical expenses, then look at some of the other more affordable benefits like dental, vision, and hearing from one plan to the next. Yeah, absolutely. Let's see. Check meds. Here's another resource. Always check the cost of your meds at goodrx.com because it may be less than what you'd pay for your Part D or under 65 health plans copay. Mark Cuban's Cost Plus Drugs and even Amazon now are other alternatives. Another great resource, CanadianMedStore.com, helped a number of clients that are on very expensive medications like Januvia and all kinds of medications that are patented, very effective. Xarelto is another one, much cheaper in Canada. Don't ask me to explain why, or we'd be here all day, and I still, couldn't explain why. But that's just the fact of life. Canadian Med Store is a Clearwater, Florida-based online pharmacy, and they 2 days ship from legitimate Canadian pharmacies. They will ship medications that are manufactured in the same manufacturing plants that U.S. medications are from the same companies, and it's often that you can save $100 or more, or more if a medication is non-formulary or even in formulary. And one last thing our parents used to do is that's to use a pill cutter. Always choose tablets. Capsules are usually not covered under a formulary, especially in Medicare. The tablets are, and pill cutters are still a great way to cut the cost of your medications. Yeah, yeah, I can't without really going in there. But the only last thing there is always choose tablets. They're going to be less expensive, and our parents used to do it. I know mine did. Cut your Ask your doctor to prescribe the highest dosage tablet available, and make sure the doctor knows you're asking him to do that for use of the pill cutter. And so you can medic stretch that tablet twice as long. Okay, last word. Everybody thinks about cost or premiums or out of pot. What am I going to spend after subsidy, or but you got to think about risk, and this is what nobody talks about. How much can you afford to spend, but also think about how much you can afford to lose. And I love this. Uh, Never let adult children, could be your spouse, could be your brother or sister. Never let adult kids make their own health decisions, and also don't trust call centers or healthcare.gov. They are all incentivized to sell on cheap, and sell on cheap is being sell penny wise and pound foolish if you don't evaluate risk. So don't let friends or spouses make cheap healthcare decisions, because it can very well bite them. And don't be too proud to ask for help, just like a job search. You don't know what you don't know. What you don't know can put you and your family at risk. And spend your time doing what you do best and nail that next interview and that next job and return on time invested. And know the difference between opinions and expert advice. And I'm going to shut up. I've gone way over. Thank you, Mike, for not getting the hook out 25 minutes ago. Here's my contact information, a couple of QR codes. I will record this when I shut up and answer all the questions. But feel free to call me. I will be able to answer, as I mentioned, calls and texts a whole lot faster than I can emails or LinkedIn connections. But I'm one of the top people in DFW in terms of LinkedIn connections. And if I have a personal, someone I know personally, and it's for a company that you are targeting, I'd be more than happy to make an introduction. But if it's just another like Facebook friend on LinkedIn, it's not worth your time. But I'll be more than happy to help. And feel free. You can click on the two QR codes, enter your information. I'll get the info, and then you'd be that much further to knowing what your options are. And thanks. I'm going to shut up and answer any remaining questions. And thanks for your time. And I've gone over almost an hour, half hour. Mm-hmm. Well, there's different moving parts. A and B, you just continue to pay the premiums, whatever that is, from year to year. Okay, Medicare supplement plan, you can stay with that if you signed up for one, as long as you continue to make the premiums. Medicare Advantage plan, those change every year, and some plans are and companies like Care owned by UT Southwestern, they pull out of the market. So that is something you do need to change every year, or at least examine every year. You may not change, but you need to examine, because the plans change, the beds change, the doctors that are in network, and your health changes. Mm-hmm. Mm-hmm. Well, the AARP is a brand license that United Healthcare purchased a long time ago. Now, and they are one of the top they are the top Medicare company in the country. But AARP itself and the plans marketed there, if you went onto AARP website and somehow connected to a call center, they're not going to tell you what the other options are. Uh, that's a great company. It's one of the top companies that I represent, along with you know any number of other companies. But again, the moving parts. Uh, but you brought up another question, Mike. At age, if your company, and again, you don't know what you don't know. If you're on Medicare, and your company ceases to exist, or your plan ceases to exist, there are this year I mentioned Care, which is a company owned by Texas Health Resources, UT Southwestern. They pulled out of Medicare Advantage. Also, Blue Cross Blue Shield dropped some specific Medicare Advantage plans this year. You qualify for a Medicare supplement plan when that occurs during that plan year. So that is an option to switch back, even though you may have medical conditions. So you could switch to a Medicare supplement plan beginning January 1st. But to answer your question about AARP, United Healthcare, it's the same darn plans that any agent represents, and it should be one of the companies that they evaluate when they're reviewing your doctors and your hospitals, your prescriptions, and your out-of-pocket medical expense risk versus the other plans in your area. Mm-hmm. Sure. Yeah, I'm sorry. I talked everybody away, but you can tell I'm passionate about this stuff. Sure, sure. You bet. All right. I'm going to stop screen sharing. And thank you. I'm going to scoot, but feel free to reach out to me one on one. I'd be happy to answer any questions. Thanks again. Bye bye.